All right, welcome everyone. This is our info session, February 22nd, 2023, regarding our recent release of the Youth Homelessness Demonstration Program, otherwise known as YHDP, Behavioral Health Supportive Services Only, specifically procuring the Peer Life Coach Request for Qualifications program. So before we jump in, I just want to center us on KCRHA's theory of change and sort of our equitable decision-making approach as it relates to our procurement processes. Our theory of change at KCRHA is if we create a homelessness response system that centers the voices of people who have lived experience of homelessness, then we will be able to focus on responding to the needs and eliminating inequalities to end homelessness for all. So we are seeking partners that align with this philosophy. Additionally, related to our procurement processes, therefore, we are committed to equity-based procurement that A, deconstructs processes that perpetuate oppression, and B, creates accountability to and positions people with people experiencing homelessness as decision makers and key stakeholders within these systems. So that is our aim as we release our various RFPs, RFQs, and other funding processes currently and in the future. To transition us a little bit to specifically talk about the YHDP Behavioral Health Services Only. So that's jargon, that's language that comes from HUD, which is the fund source involved in this RFQ. But specifically the program that we are aiming to award is the Peer Life Coach model. And the Peer Life Coach program, we are seeking applicants who are interested in operating a peer life coach model, which will support young adults ages 18 to 24 years old who are experiencing literal or imminent homelessness to obtain or maintain housing by providing support services focused specifically on behavioral health coordination, which may include discharge planning and other connection to other services. While also maintaining the existing YHDP behavioral health SSO parameters. So SSO stands for support services only. Again, that's sort of the terminology that HUD uses for this body of work and body of funds. The core services and service letter levels as outlined in this RFQ, which we'll get to. The ultimate goal of this investment is aims to reduce entries into homelessness, increase housing stability, and increase behavioral health service connections for young adults experiencing or at imminent risk of homelessness. When we are talking about the funding, so this RFQ is funded by one fund source, which is from the fiscal year 2021 Youth Homelessness Demonstration Grant. There is a total of up to $93,898 available through this RFQ. Want to highlight that this is can be a barrier to organizations, but there is a requirement to be able to demonstrate the ability to provide a 25% match annually. And again, that's just a HUD compliance requirement. And that match money cannot be other COC or continuum of care HUD funds. It has to be another fund source that's not HUD. This funding is available starting April 1st of this year through November 30th of this year, with a high potential of a renewal beginning in December of 2023. So continuation of services are anticipated, but again, it totally depends on our rating and ranking through the HUD renewal process and the ability to sustain funds in our continuum of care. So applicant eligibility. So for agencies that are interested in applying, here is the eligibility requirements. May not be operated by a HUD-funded joint component housing program. So that may disqualify some organizations who are doing this work and who may be interested. So I want to highlight that first. Eligibility, organizations must adhere to housing first practices and serving households experiencing homelessness. Align with the screening criteria for program eligibility requirements, which are set by HUD. Participate in and accept all new program participants through defined referral process, which we'll get into in a little bit later. Also, agencies are required to meet KCRHA's minimum eligibility requirements, which are set forth on our website. Encourage any potential applicants, especially if you have not already contracted with KCRHA, that you check that out before starting your applications. Applicant eligibility continued. So there is a data requirement for any successful applicants to participate in King County Homelessness Management Information System, or HMIS. Entries into HMIS help to evaluate and improve the quality of programming in our region, specifically COC and otherwise. The program or the applicant who is awarded funds under this RFQ is expected to contribute to performance outcomes as measured in HMIS, and then any other outcomes that may be negotiated post RFQ award. Just the kind of high level point to this piece is that there is going to be an accountability, some accountability around data entry related to performance and targets for the successful proposer. Data elements, just to give you a sense on sort of like the scope and what will be requested, are quarterly enrollment targets, average length of enrollment, percentage of youth adults in permanent and transitional housing that do not return to homelessness within 6 months, percentage of youth adults in permanent and transitional housing that do not return to homelessness within 12 months. And then LGBTQAI identified youth and young adults of color who achieve program outcomes at the same rates as the overall population is sort of one of the race equity-based performance measures as well. Agencies are expected to follow current and appropriate safety protocols related to the prevention and spread of COVID-19. The protocols are pretty standard and we're pretty hopefully used to them by now: social distancing, wearing masks when needed, hand washing, things like that. This particular RFQ is open to nonprofit entities only. That is true. KCRHA does not contract services with for-profit entities. But you will need to applicants will need to be able to provide DUNS number and SAM registration number and be in good standing as part of the eligibility for this RFQ. That only applies to nonprofits, but that's kind of irrelevant because this is actually only open to nonprofit organizations. When it comes to eligibility regarding customers, consumers, or clients accessing the Peer Life Coach program, again, young adults ages 18 to 24 who fall within the specific HUD categories of the 1, 2, or 4 of HUD definition of homelessness. So literally and imminently experiencing homelessness will qualify. Services will be available to support programs across King County who are operating under joint component model. So this is not a Seattle-centric funding opportunity. It can be organizations across King County are encouraged to apply. Case managers and or behavioral health specialists within referring programs can assist Peer Life Coach to joint component participants who meet the Category 2 definition of homelessness as set forth by HUD. So those are two of the sort of the referral pieces for client or customer eligibility for this program. So when we talk about what is sort of this peer life coach model, what is the scope? Working with, it can kind of include many things. I'm going to highlight sort of the essence of it, encourage you to also take a look at the RFP, which is posted on our website. There's a chart in that in the guidelines that kind of further outlines the various elements within the program scope. But generally working with young adults to identify strengths, desired services, community resources related to well-being, and focus on mental health and substance use. So the focus is pretty laser when it comes to that on wellness and mental health services and kind of that triage between. Assisting young adults in identifying services and activities that promote recovery and lead to increased meaning and purpose. Work with young adults to co-create a discharge plan for individuals exiting inpatient medical or behavioral health or substance abuse treatment programs. Facilitate groups, triage behavioral health or substance abuse treatment services. Assist young adults in developing their own goals and working towards those goals. Share their own recovery stories and are relevant in helping and overcome obstacles faced by individuals and families. So we are seeking a agency that is interested in employing somebody who has lived experience of homelessness and could hold this position as a peer coach. Promote personal responsibility for recovery. Assist in a wide range of services to regain control and success in their own lives, such as developing supportive relationships, self-advocacy, stable housing, education, and employment. Essentially serve as an advocate, model skills in recovery and self-management, and complete documentation about their services for Medicaid and any other kind of employer requirements that might be needed for your organization. Ineligible costs for this RFQ include funding services to cover costs that are not identified by HUD guidelines, and we can I would just encourage applicants to refer to the HUD website on ineligible cost and eligible cost. Fund behavioral health services otherwise eligible to be paid through by King County Behavioral Health Organization or BHO, or fund an activity that can be billed to a source for which it's otherwise eligible. We have a quick turnaround time here, and I do apologize. This is an existing contract that will be ending, so that is, transparency-wise, the reason for the quick turnaround is to ensure we have a continuity of services. The funding opportunity was released the 10th of February. We are currently at the information session, so feel free. We will have a moment at the end to ask any questions. We also have an online Q&A that we check frequently, and we'll post answers publicly for anyone who may also have the same questions or need some answers. The last day to submit those questions is going to be February 24th, this coming Friday. Applications are open and available through Flux. We'll get to that some more, but Flux portal has been opened and the RFQ is live there for your review and preparation. All applications are due Friday, March 10th by 11:59 p.m. Pacific Standard Time through our Flux system. Flux is the grants management system that KCRHA uses for all funding opportunity proposals and applications. We anticipate making awards to all applicants by Monday or on Monday, March 27th. And then contract development and implementation is anticipated April 1st to avoid any stop in services, any end of services. Some more information about the application specifically. So if you have not already done so, if this is your first time wanting or being able to work with KCRHA, first register through Flux. That's our grant management portal. The application is composed of various sections that are asked in mostly narrative form, with the addition of an Excel budget template that is we asked to be attached, including a budget narrative. The whole proposal is worth 100 points. And again, is broken down by different sections and different various questions that are weighted accordingly and equal 100 points. We encourage folks, just because technology can be our worst enemy sometimes, to make sure as a backup to first write your narrative sections in a Word document before copying and pasting into Flux, just in case something happens and you know, things don't get saved or something like that. You'll have a backup for your work. Please use plain language to spell out, please use plain language and spell out any acronyms. Know that we construct the rating panels with a variety of different perspectives and sort of level of understanding of like the professionalization of this work. So using plain language and spelling out all your acronyms will help to ensure that folks that are going to be rating and recommending applications actually understand what's being conveyed in those applications. So please keep that in mind. Be clear and concise about what you are proposing to do. We also ask that folks, applicants, upload supplemental attachments. These are pretty standard for most of the procurement processes that KCRHA releases. So Flux generated cover letter, you'll see that once you register, you'll be prompted to fill that out. That's going to have basic information like point of contact, the amount you're requesting, you know, nuances, kind of high level nuances of your application. The budget narrative is we ask that you submit as a PDF. There are 2 sections, so there's 2 tabs to that Excel template, so be sure to complete both. There's one that's a program budget, and then there's one that is specific to personnel, and it kind of gets granular on the personnel aspect or personnel line item of the budget. And those should also be uploaded to Flux along with your narrative sections. We ask that you also include your current fiscal year's financial statements, which includes a balance sheet, income statement, and statement of cash flows, which are certified by your agency's CFO, financial officer, or board treasurer. Your most recent audit report, a copy of your most recent audit report, a copy of your most recent fiscal year-end Form 990, SAM registration, and a copy of your 501c3 status. Are also included as uploads within your Flux application submission. So that is it for our overview for this RFQ. Curious if our booming audience has any questions for me today. Great to see you, John.
Oh, I should actually unmute and not just start video. So I guess the question that I have is just that, you know, that first qualification point about organizations that are operating a joint component site. Isn't the bridge, that's our joint component site, correct?
Yes. Yeah. So unfortunately, yeah, it sounds like it probably would not qualify.
Mhm.
But if you have any partnering organizations who, don't fall under that you feel would be good partnership, that could be a potential of, to leverage some of these resources and your, youth care's expertise in this area too.
Yeah. All right. Well, yeah, I guess that was my main question. I hope that there will be some other applicants.
Yeah, I know, me too. So yes, please help get the word out. I know that's one of the barriers in this, and that is a HUD sort of, HUD restricted part of this fund source. It's not something we implemented.
Mhm.
So hopefully, yes, we can identify a great partner that's going to be able to offer those much needed services that young adults that your organization and others are working with as far as behavioral health supports go.
Yeah, it is unfortunate because we have actually somebody who trains people.
Oh,
I know.
right. Yep. So
Yeah.
encourage creativity. Unfortunately, we can't kind of go outside of those
Yeah.
eligible restrictions per HUD, but obviously, so much needed service that will end in March if we can't identify another successful proposer.
Is THS still doing it?
Nope, THS will not be doing it effective March, the end of March.
Right. But so they were still doing it through March, or
I believe so.
theoretically.
Yep, I will stand corrected if I'm not totally sure the status, to be honest, at the moment. But we know for sure they will, it's needs to be reprocured before April 1st. Yeah.
Okay.
Yeah. Thank you, John, for joining. Gonna just wrap us up. Any other last questions?
Nope, that's it.
Okay. Thank you so much. So just an encouragement, this recording will be posted on our website. So if you weren't able to make it, John, if you could help get the word out, and others, please direct folks to this video. We are also available for additional questions, which again, we'll post publicly any answers we share by this Friday. You can email your questions to rfp@kcrha.org. You can also find on our website, which is kcrha.org, under the resources tab, under the funding section, all of our NOFAs. We are almost at a place where we're going to actually post an annual NOFA any day now, in addition to the others that we have several funding opportunities currently open at the moment and a couple more on the way. There you will also find those live funding opportunities. This is one of 4 at the moment. Our recorded information sessions, and then also tap to the Flux portal, which is our grants management portal. All right, so this concludes our information session for the YHDP Behavioral Health Support Services only RFQ, specifically aiming to procure services related to a peer life coach model. Thank you, John, for joining. Thank you all who will view this recording for listening, and look forward to reviewing your applications. Thank you.
Thank you very much.
Yeah, have a good one.
You too.
Bye.